नमस्कार, आपके साथ मैं हूं आरजू दुबे। हम आपको लगातार दिखाते हैं कि आज का नोएडा जो है वो कैसा है। हर एक सेक्टर में नोएडा किस तरीके से काम कर रहा है उसको हम आप तक दिखाने की कोशिश करते हैं और आप तक एक एग्जाम्पल सेट करने की कोशिश करते हैं कि किस तरीके से आज के नोएडा में काम हो रहा है। हम लोग जेपी हॉस्पिटल में इस वक्त मौजूद हैं, जहां पर आज का नोएडा कैसा है और जेपी हॉस्पिटल की अचीवमेंट्स क्या हैं उसी पर बातचीत करेंगे। मेरे साथ इस वक्त यहाँ पर मौजूद हैं जेपी हॉस्पिटल के सीईओ साथ ही डायरेक्टर डॉक्टर मनोज लूथरा जी। मिलकर स्वागत करते हैं उनका। सर, बहुत बहुत स्वागत है आपका।
थैंक यू सो मच फॉर द इंट्रोडक्शन। आई विल बी हैप्पी टू आंसर एनीथिंग दैट यू आस्क मी।
शुरू करते हैं सर।
एब्सोल्युटली।
Sir, what does your hospital specialize in the three major sector of emergency healthcare?
See, emergencies actually can involve any specialty.
Yeah.
And in general, if you were to look at the emergency and ask me what is the maximum emergencies that come to the hospital, I would probably place trauma and as the number one emergency which comes to the hospital. Whether it involves the neurosurgeon, or involves the orthopedic surgeon or involves the chest surgeon, trauma is the foremost emergency that comes to the hospital. The second emergency that comes to my mind is really cardiac emergencies, whether it's a heart attack, whether it's a cardiac failure. All those are the cardiac emergencies. I place them number two. The third emergencies which come to mind are probably respiratory emergencies, where the patient has a respiratory problem, whether it's an asthma or acute bronchitis and has difficulty in breathing. Once you exclude these three areas of emergencies, then any other specialty can present as any other disease can present as an emergency. Even high fever, dengue itself, infective diseases, and gastrointestinal diseases can present as emergencies.
Sir, what are the best OT and lab facilities that you offer?
See, we have a total OT complex of 18 theatres which are equipped to the teeth, and whatever a surgeon can ask for. They are large theatres, modular theatres, where everything is controlled, whether it's the temperature, whether it's the atmospheric filtration, whether it's the humidity, all that is controlled in the theatres. Our lab is again a state-of-the-art open lab where we have not only histopathology, microbiology and hematology, plus the blood bank. All these are an open system. We do not have all the reports are put on the computer. All the lab specimens are sent by chute to the lab, so nobody carries them personally, and a total sterile technique and area is maintained in the laboratories.
सर, जैसा कि मुझे पता लगा है कि पिछले 5 सालों में कुछ ऐसी रेयर सर्जरीज हैं जो कंडक्ट की गई हैं, क्या है वो, कौन सी हैं?
ऐसे आप मेरे से पूछेंगे कि क्या रेयर सर्जरीज हैं, इट्स वेरी डिफिकल्ट टू से, बिकॉज एवरी डिपार्टमेंट हैज डन स्पेशलाइज्ड एंड रेयर सर्जरी। जो भी आप सर्जरीज देंगे, कोई भी डिपार्टमेंट लेंगे, आई कैन टेल यू इट्स अ रेयर सर्जरी। अगर आप हम ट्रांसप्लांट के बारे में बात करें, हमारा जो ट्रांसप्लांट यूनिट है डज अ सिग्निफिकेंट नंबर ऑफ एबीओ इनकम्पैटिबल ट्रांसप्लांट, एंड मेरा ये मानना है कि वी आर वन ऑफ द फ्यू सेंटर्स इन द कंट्री जहां हम एबीओ इनकम्पैटिबल ट्रांसप्लांट्स करते हैं। सो एनी एबीओ इनकम्पैटिबल ट्रांसप्लांट वुड एक्चुअली बी अ रेयर सर्जरी। ठीक है, अगर आप रिकंस्ट्रक्टिव सर्जरी में देखें, मेरे को ये पता है कि इन्होंने नंबर ऑफ टाइम्स जो टोटल इंडिविजुअल का लिम्ब लॉस हुआ है कि लिम्ब के साथ अलग से हाथ लेके आया है साथ में कि भाई ये लिम्ब मेरा लॉस है, कि इसका आप कुछ कर सकते हैं, दे हैव पुट द लिम्ब बैक इनटू पोजीशन। सो दैट वुड रियली बी अ सर्जरी व्हिच इज अनकॉमन। हमारे यहाँ जितने पॉइजनिंग केसेस आते हैं, स्पेसिफिकली सल्फॉस पॉइजनिंग एंड ये जो इंसेक्टिसाइड पॉइजनिंग केसेस आते हैं, इनका जो मोर्टालिटी रेट इज वेरी वेरी हाई। हम लोग उनको एक नई फॉर्म ऑफ ट्रीटमेंट है जिसको बोलते हैं एक्मो। हम उनको एक्मो मशीन पर डालते हैं जब तक के पॉइजनिंग का इफेक्ट नहीं चले जाता है एंड द पेशेंट रिकवर्स। ऐसे ऑलमोस्ट 100% रिकवरी रेट है एक्मो के साथ पॉइजनिंग का, इंसेक्टिसाइड पॉइजनिंग का। and which I think is a very very rare condition. Rare in the sense that कि patient otherwise survive नहीं करता, but यहाँ आके हम जब ECMO पे डाल रहे हैं, he is able to survive and we have achieved almost 100% success rate. तो ऐसे अगर मैं देखूं तो हर एक department में there are number of things that they do is actually what would I would call it a super specialized form of treatment.
Sir, health tourism is now becoming a major area of the economy, and India has become a major hub. Is this because we have the best labs, surgical abilities and best doctor? Give us some example of your hospital.
देखिए जो हमारा hospital itself है, we treat a significant number of international patients.
All right.
In fact, at any one time, between 1/5 of the patients to 1/4 of the patients in the hospitals are patients जो abroad से आए हैं, whether they are from the neighboring countries like Bangladesh, Nepal, or further countries Central Asia से जैसे तजाकिस्तान, कजाकिस्तान, किर्गिस्तान, तुर्कमेनिस्तान, all these countries, अफ्रीका से हमारे पास आते हैं, अफ्रीका, इराक, इथियोपिया, कैमरून, then ईस्ट से अगर ले लीजिए तो कंबोडिया, बांग्लादेश, सब जगह से हमारे पास patients आते हैं. And the reason I believe these patients come to India, foremost of course, India provides treatment at a cheaper rate than anywhere else in the world. And cheaper rates treatment does not mean that our technology is inferior, our medicine treatment is inferior. In fact, our treatment is at par with what is available in the West. So we provide treatment which is available in the West at a much more competent rate or at a much cheaper rate. So that is one reason why patients come to India. Second is our technology today in the corporate hospitals is as good as technology elsewhere in the world. The moment a machine comes elsewhere, it's available in this country also. So we are providing the same treatment at a cheaper rate. In addition, I also believe that we are ethical in our methods of treatment. Given all these, you find that India is developing as a medical tourism hub in the world, and it is my belief that we do almost $8 billion of medical tourism in this country every year.
All right. So what is your forward plans in the terms of establishing medical excellence, both technology and human welfare services?
See, we, our founder chairman himself, that this hospital should not only provide affordable treatment, but it should provide ethical and affordable treatment for the masses. And that is our motto, that we should be able to provide that kind of a treatment. And with this motto, we have been progressing in the sense that we have the latest of technology which is available, whether you talk of a PET scan, whether you talk of a CT scan, whether you talk of interventional radiology, whether you talk of transplants. In all aspects, we provide whatever is technologically one of the best or whatever is available as a leading technology brand in medicine. We are providing it here. And at the same time, our charges have been kept as low as is feasible, so that the main aim should be that the patient should go away happy. Should not have to spend so much for his treatment, and at the same time he should receive the best treatment and go away happy. With that, we have been trying to expand all our departments. In every form of specialty should be available here under one roof, whether it is in cardiac surgery, cardiac sciences, neurology, transplant. All specialties are available here under one roof, and the best in each of these specialties is available. And that is what we are striving for.
Thank you so much, sir, for giving us your precious time. Thank you so much.
Thank you.
तो आज के नोएडा में बस इतना ही. नमस्कार.